Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida here in Fort Myers, Florida. We get emails all the time, texts, different inquiries from our YouTube videos. So I like to answer questions. So it said, hey doctor, I have a potential patient who is a boxer and he suffers from 4-disc herniation. He also has numbness in his hands. Do you think prolotherapy can help? So I just want to go through, when is somebody a surgical case? When prolotherapy is going to work? When is physical therapy going to work? So you guys know from previous videos that there's many people who have no pain and they have disc herniations. Like when they've done MRIs on people who are asymptomatic, they have a high propensity toward disc herniations. And if somebody has a symptomatic disc herniation, that normally irritates the nerve, so they have pain down the leg. When I talked to this provider, they said, nope, they don't have pain down the leg, they just have low back pain. So my belief is that almost all low back pain is from the excessive stretching of the ligaments and the nerve endings in the ligaments. So I told this provider that, yep, as far as like their low back pain, they're a candidate for prolotherapy. Now, as it relates to hand numbness, that can be from various causes. So we're going to talk about the various causes. So, when is hand numbness from like a pinched median nerve in the wrist or a pinched nerve in the neck? So this slide is very important. True numbness, meaning a person has a sensation of numbness, and then when you test the skin, they might say, yeah, doc, this compared to this, because this is the ulnar nerve, this feels 25% less. Like that's true numbness. So true numbness normally is that there is a nerve that's getting compressed or stretched. So that normally is carpal tunnel or cervical radiculopathy. So this area is normally C6. So what we would do is do a digital motion x-ray and see if the C6 nerve root is getting compressed. So we would see the foramina would collapse. Carpal tunnel syndrome we diagnose by dynamic or motion ultrasound. So say somebody has a numb feeling and I tested their sensation. They said, no doc, it feels exactly the same. So I would call that numminess. Numminess is almost always from a ligament problem. So injury to the ligaments on the lateral side of the elbow, specifically the annular ligament or the radiocollateral ligament, that can give you numminess down the arm into the hand in the same distribution as the median nerve. So this just describes that cervical radiculopathy, that will give you pain sensation or numminess. Like on the right side, it's when you extend and you turn the head to the right. So in other words, I have some C6 radiculopathy, so if I kept this position long enough, I'd get a little bit of tingling in the area. I don't have any numbness or anything. Where if you go like this for a minute or you go like this for a minute and you get increased numbness in your hand, that's from carpal tunnel, because that will increase the tension on the median nerve. So that's just that's called, I believe it's called Phelan's test. So a lot of times in the office, I'll have the people hold this for like a minute, and I'm trying to distinguish if I compress the median nerve, for a minute, do they get increased sensation? That's a sign of carpal tunnel. Carpal tunnel is that the median nerve, you could see where it goes into the thumb, index, middle finger. So that's why you get numbness, because it's getting pinched there. And the gold standard has always been EMG, or nerve conduction velocities. I used to order these all the time, and honestly I don't really order them too much anymore because we just diagnose it by ultrasound, and then with ultrasound we can stick a needle in there and we can release the nerve by a process called hydrodissection, where we just put some fluid around the nerve and it frees up the nerve. Now, cervical radiculopathy is often, not all the time, it's often from a ligamentous problem. So This is actually me, this is years ago. You could see that when I flexed, the neural foramina were open, but when I extended, see right here, see here and here, you could see the neural foramina here got obstructed because there was ligamentous injury in my facet joint. See how the two bones here, they went apart when I went like this. And then as I got prolotherapy and that resolved, then basically 98% of my symptoms resolved. If you have numb sensation in your hand, I just ask you, yourself, just see, does it feel the same? And if it feels the same, then I'd say, hey, poke on your elbow and just see if it hurts a lot. If it hurts a lot, you probably have an elbow issue that you may not know about. If you go like this and that causes numbness, that's probably carpal tunnel syndrome, so I'd recommend you get some hydrodissection. And if you, with certain kinds of neck rotation, you know that that makes it worse, then it's probably a neck problem that you should receive a digital motion x-ray. And then if instability is found, then the treatment of that is prolotherapy.